Hey, it's Dave here, and in this video we're going to talk about how you might be able to discontinue the use of your acid blocking medications. Now, just a disclaimer before we get into the material. It's very important that you make sure that your doctor is informed at all times if you want to go through this process. I don't recommend you try to do it on your own. I recommend you hire somebody who knows how to wean you off these medications without any undue discomfort. Do it nice and safely, and the doctor should be involved at all times with this. Because I'm not a doctor, I'm not allowed to say to you, you can or you should discontinue any form of medication whatsoever. So that's not the purpose of the video. The purpose of the video is actually to encourage you that if you've been taking acid blocking medications, particularly the proton pump inhibitors, for a long period of time, you struggle to come off them, and you're worried about some of the potential long-term effects of continuing to take them, then you can get off them, okay? But as I say, just because you can get off them, I'm not telling you to stop taking them, all right? Just to make that absolutely clear. There's a specific process that we've used with quite a lot of people to help them discontinue these medications where previously they've not been able to. So let's have a look at the reasons why you might want to discontinue them. Let's have a look at the process behind which we've helped people discontinue these meds. And then if you want to work with your doctor to follow this process through, and you want to get us involved as well, then please let us know. Okay, so let's go. So the rationale behind discontinuing things like proton pump inhibitors is threefold. First, you are not addressing the root cause of the problem while ever you are just taking medications to mask the symptom. So I understand it feels uncomfortable. It's not pleasant to have heartburn and acid reflux. I used to have it myself. I know how uncomfortable it was when it was at its worst. But you're not addressing the root cause by just trying to take a drug to block your acid production. Worse, in some cases, the underlying reason for the heartburn and the reflux to start with was already low stomach acid. So if you have low stomach acid and then you make it even lower, you're actually really not getting anywhere with resolving the underlying cause of the problem. When you completely block out your stomach acid production, you increase your risk for certain types of infections, like, for example, Clostridium difficile. You increase your risk for things like small intestinal bacterial overgrowth and other forms of dysbiosis, which can then actually go on to contribute to the very symptoms that you're trying to get rid of by taking the proton pump inhibitor. So it's a bit of a paradoxical situation. And you also increase your risk of nutritional deficiency as well. While the data are not crystal clear in this regard, some studies suggest that vitamin B12 levels drop because you're not absorbing it properly. Some studies suggest that magnesium might be a problem, and the various other nutrients as well. So they're the main rationale or points of rationale as to why it might be a good idea to discontinue these meds. The problem that people have when they try to discontinue the meds in some cases is they get something called acid rebound. So they try to stop the medications, but then the symptoms don't just come back. They come back with a vengeance. Like they have like a couple of days of major pain. And it's like, it's not just heartburn, it's incredibly torturous burning and pain sensations. And that's called rebound acid production. And that is a plague for certain people trying to come off these medications, unfortunately. And so what we want to be doing, of course, is then trying to figure out a way that you can get off the medications safely, that you can do it comfortably without this acid rebound, and then you know what to do to investigate the underlying causes of the problems, and that's what we're going to talk about in the next video. But certainly the safety and the comfort issue of getting off these meds is critically important. So this is how we would approach the situation with a client who said, we want to get off these medications. First of all, we'd say, we're not doing anything unless you involve your doctor in this process. The doctor has to be involved at all stages, all times, to make sure that the medical provider is kept in check, if you like, or in the loop. What we would do is, first of all, look at all the simple possible causes for heartburn and acid reflux. So these are things like your diet, the foods that typically can irritate the the stomach lining or weaken the lower esophageal sphincter. So it's things like coffee, chocolate, mint, tomatoes, onions, things like that. We'd want you to discontinue alcohol because that can be a major cause of heartburn. Smoking might come into it as well. Can you reduce the amount of cigarettes you're smoking or even stop? Then we might consider sending you to a manual worker who can actually adjust the diaphragm, because maybe the diaphragm's tight, maybe there's a little hiatal hernia in there, and a really skillful manipulation of the diaphragm down here by, say, a visceral osteopath might actually help to resolve the symptoms as well. A couple of simple things that you can do. We'd also look at eating habits. Are you stuffing your face with large meals? Are you eating too much fat? Are you eating on the go? Are you stressed? Or are you giving your body time to actually digest the food properly? Because sometimes that can be a huge contributing factor. And then we may also use a week or two's worth of calming, soothing, anti-inflammatory supplements, particularly herbs, things like chamomile, slippery elm, gamma oryzanol, licorice root, things like that, to help calm the system down. Turmeric or curcumin is another good example, to calm all of this stuff down so that when you stop taking the medications, you minimize the acid rebound. And even if the acid rebound happens, you've calmed the stomach down, you've given the stomach lining some support and what have you, and it doesn't cause the same level of discomfort. So we would do all of that first. And then we would say, right, let's wean you off the meds slowly. Don't do it cold turkey. If you're on a relatively high dose, ask your doctor for a lower dose. Start taking the lower dose first for a week or two. Then go to a lower dose. See how low you can get with your dosing. And then instead of taking the meds every day, go to once every 2 days, and then once every 3 days, or once every 4 days. And so gradually just bring the intake of the medications down whilst observing all of these recommendations. And that is usually a really effective way to help you get off these meds, even if you've had difficulty doing so in the past. So not everybody needs such a complex shall we say, involved process. Some people can just cycle on and off these meds without any problem whatsoever. But if you have had difficulty and you are concerned about it, then there is a way, there is a solution for you, as long as you keep your doctor in the loop and informed at all times. So I hope that one has been helpful. As I say, in the next video, we're going to start to talk about getting to the root cause, figuring out what's actually causing the heartburn symptoms, particularly in cases where, you know, you stop drinking, you change your diet, you do all of this stuff and it still doesn't work, right? That's when we need to get the lab testing involved. So we're going to talk about how the medical system will test and how I would test, or functional medicine practitioners would test, compare and contrast the benefits and drawbacks of each type of testing, and then you have a full arsenal, full set of knowledge for you to go away and think about in terms of what you want to do to figure out exactly what's going on. So as I say, I hope this has been enjoyable and informative, and I'll catch you soon to talk about how we uncover the root cause of heartburn and reflux. Thank you.